Hi, Carol. Welcome.
Hi, welcome. Glad to be here.
Thanks for coming in. Before we go specific questions, I would love you to share your background and your experience and how your purpose, values, and beliefs have evolved.
Yeah, and they certainly have. So I actually started my career as a nurse, and I probably knew from when I was at school that I wanted to be a nurse, and I'm not sure why. When I look back, I probably just wanted to care for people. And when I was at school, I only did what I needed to get into nursing college, and that was it. So I wasn't an overachiever. And did nursing in Scotland, and then when I was 29, I had 2 kids and a husband, and migrated to Australia and came to Perth. So I've always lived in Perth in Western Australia, and it is a great place to bring up kids. And being a nurse, it was probably easy because I knew that I would actually get a job here. And even though it was part-time when I had the kids, I did work, and I worked in hospital. And as I said, I'm not sure why I actually went to work in the hospital, because I never actually liked working in the hospital, because I always thought it was very impersonable, and you actually couldn't get to really know the people that you were actually caring for. I then left the hospital system and went and was a district nurse for a while.
Okay.
With Silver Chain, and really loved that. And I really loved going to see people in their own homes and really being part of their life. And I think that's what drove me to community care. And then I went back to uni, because then I became an overachiever as I got older. And went back to uni and actually did my nursing degree, because I went to nursing college and did real nursing, and did my nursing degree. And then I did my master's in health management. So then I actually progressed my career and went into management. And I loved that as well, because I still felt like I was actually contributing to people's lives, and actually making their life as good as it could be, especially in their older age. And even when I was a nurse, I worked mostly with older people, so I must have always had an affiliation for that. And I worked for several organisations in Perth. At one time was a general manager for a company for Silver Chain, and general manager of country services. So I've seen a lot of Western Australia and a lot of different people, and been very privileged to do that. And it was really great.